Good morning, Norm Boyd. I just wanted to make sure that I'm on and I'm getting volume. Thanks.
Good morning. Yes, I can hear you.
Thank you.
You should be able to unmute training room. Hmm.
We're good.
We're good? Okay. Alexandria, Mr. Kurz might be muted.
Good morning. I can hear you now.
Mr. Kurz, can you hear us?
Yes, I can. Good morning. Can you hear me?
Yes, sir. Yeah, we can hear you.
Are we ready to begin?
Yes, sir.
Okay. All right. Good morning, everyone, and welcome to the Audit Committee meeting. We have the agenda in front of us here this morning. I'd like to begin by asking our board members, um, if there's any changes to the minutes of the March 12th meeting. Those minutes were sent out previously, and I didn't see any corrections, but I wanted to see if anyone else saw any corrections needed to the minutes from March 12th. Okay. All right, hearing none. The other item that I wanted to touch on real quick with our board members is that about a week ago, I sent to our board committee members, Dr. Ruth, Mr. Boyd, and Dr. Hopkins, a copy of our audit committee charter that was prepared a number of years ago. We have not reviewed it recently, but I wanted to have our committee members review it to see if there's any need for update. So I did not see anything. Does any of the board members have questions or comments about the charter for the audit committee? All right, hearing none, then if we just let the minutes reflect that.
Yeah, sorry, I didn't unmute myself. I think you can hear me now. I didn't see anything in the charter that needed update or change. I have a suggestion for a future meeting. Subject might be in this area where it says review of the department's periodic report on major financial risk exposures, which example might be you've always got a potential exposure to things like cybersecurity hacks and that kind of thing. But I don't know that we've had a review of that recently. Might be a timely subject to have a department give us some update or discussion on what those areas are and what actions are being taken. That's just a suggestion. Thank you.
Thank you, Norm. Well said. And we'll let the minutes reflect that we did review the charter and record Norm's suggestion as well. Thank you. All right, so the next item on our agenda are opening remarks from Joe Hood, Chief Compliance Officer for the department. Joe, we'll turn it over to you.
Thank you, Mr. Chairman. Just want to welcome each of you to our audit committee today and appreciate your service. Thank you for your review of the charter and your commentary there. Mr. Boyd, we'll certainly take that under consideration. I did want to just go ahead and give you specifics on the item that you gave as an example. The department is very proud to have achieved a high trust certification for cybersecurity with our CISO, and we believe that we've done the efforts that we need to achieve defense against cybersecurity. Of course, that's an ongoing vision that we would have. That would not be, in my understanding, anything that we would have as a contingent liability due to that high trust certification that we've achieved, which is, to my understanding, a rarity for a state government Medicaid entity. However, we do have contingent liabilities or potential liabilities that we express to the Department of Audits each year when we prepare responses on our financial audit. And I can have a discussion with legal counsel and with our CFO and see if we could prepare remarks in a future audit meeting when those are expressed to the Department of Audits prior to the completion of our audit, and see if we can't bring those to the audit committee so that you have full awareness of what those contingent liabilities might be. I think that is the most on point that we would have for what you're describing. But really appreciate your review and your commentary on the charter, and we look forward to the meeting that we have set before us. We have a number of items that David is going to go through, and certainly open to questions or comments as we proceed through. Thank you so much.
Thank you, Joe, for your comments.
Yeah, thank you, Joe. We'll now turn over to David Chong, who's going to make the presentation this morning. Thank you, David.
Good morning, Audit Committee Chairman Cruz and other board members of DCH. I am David Chong, Deputy Inspector General of the Department of Community Health. And it is always a pleasure to provide an update on the status of active and completed federal and state audits. Joining me today is a member of our audit team, Cameron Mitchell. He's the new audit supervisor who recently joined DCH OIG Office of Audit. Our agenda for today's committee meeting will highlight 4 specific areas. First, audit committee charter review, which Mr. Cruz just went over. 2, fraud, waste, and abuse, request for information update, and status of current and completed audits by CMS, GAIL, HHS, and DOAA. And we'll close our audit committee meeting with update on HHS Audit Enforcement and Risk Oversight Initiative. As Mr. Cruz mentioned earlier, recently we became aware of the audit committee charter and would like to point out a few key points. The DCH Board of Community Health Audit Committee Charter establishes the purpose for the committee, including following 3 items. Provide an open avenue of communication between the board, management, and the independent auditors, including DOAA. It also provides oversight regarding the way the financial reporting of DCH is handled in accordance with laws and policies of the Board of DCH. The charter mentions that review and assesses the adequacy of the charter annually and recommend any proposed changes to the board for approval. Next, the Program Integrity Unit of the DCH OIG has recently released requests for information for fraud, waste, and abuse. DCH is currently soliciting information from vendors that can demonstrate delivery of comprehensive prepayment and post-payment review operation that provides state-of-the-art technologies, effective and efficient policies and process, and expert staff to combat fraud, waste, and abuse to enhance cost avoidance and protect the fiscal integrity of the Georgia Medicaid program. RFI will be accepted until June 16th of 2026.
David, if I could just comment
Yep.
here for committee members, I just want to give each of you an assurance that the request for information is in no way an indication that we do not have a robust fraud, waste, and abuse program within OIG for program integrity and for other issues as it relates to state health benefit and particularly to Medicaid. However, there has been an enhanced focus on fraud, waste, and abuse from the Centers for Medicare and Medicaid, and this prompted the department to see if there are any additional items that perhaps we are not employing to secure the most that we can from fraud, waste, and abuse. Recently, there was some review of an audit of fraud, waste, and abuse at the federal level. And in that report, Georgia was called out as one of the top 4 states in 2 different areas for indictment and recoupment of payments in regards to program integrity at the MFUCU level or at the Attorney General's office level. So in no way do we believe that we are deficient in this arena. However, we want to present to those who may have thoughts of fraud, waste, and abuse that we are diligently looking at all avenues to pursue them. And we want to express to CMS that we are open to additional avenues if we find some that we are not employing today. But I just want to make sure that you're aware that we're not stating, and we certainly defend that we have a very robust fraud, waste, and abuse program to date that very much is state of the art in many, many ways. So thank you, David.
Yeah, thanks, Joe, for those timely comments. We all see those kind of things in quite prevalent in the news media today. So confident that we have a good program in place. Thank you.
We currently have 4 active audits with our federal partners. The first one is Home and Community-Based Service, HCBS Services Assessment. This audit assessed Georgia's implementation of the required settings criteria. It impacts 4 waiver programs, EDWP, ICWP, NOW, and COMP programs. The next one is Medicaid Managed Care Plan Program Integrity Audit. This audit reviewed Georgia's managed care plans, utilization of cost avoidance efforts, and whether proper safeguards were in place to prevent improper payments. The third audit is HHS, Personal Care Services, PCA, and Electronic Visit Verification. The U.S. Department of Health and Human Services Office of Inspector General will review personal care services and electronic visit verification in Georgia. The objective of this audit will be to determine whether DCH comply with federal and state requirements when claiming personal care services, and if Georgia implemented electronic visit verification system in accordance with federal and state requirement. The last federal audit is HHS Clinical Diagnostic Laboratory Services. HHS OIG recently conducted an audit examining Georgia's fee-for-service Medicaid payments for clinical diagnostic laboratory services provided during calendar year 2019 through 2023. HHS OIG made some recommendations to DCH, including potential refund to the federal government, and recommended DCH to conduct a self-review of other claims, including review of payments made after their audit period. And DOAA has recently started their annual audit. The single audit report is the annual audit report of the federal program compliance, and annual comprehensive financial report is the annual report of the financial statement of the state of Georgia. It'll cover the period July 1st of 2025 through June 30th of 2026. Annually, DOAA audits the federal Medicaid program, and additional programs may be selected as part of their audit. This report is required to comply with federal grant guidance. And since the March audit committee meetings, there have been a total of 5 audits that have been completed. There was one federal audit by GAO, which we'll go over in next slide. DOAA has recently completed 4 audits. We'll go over the state purchasing performance audit and FY25 annual comprehensive financial report single audit in next few slides. GASB 75 engagement are to allocate the total OPEB, which stands for other post-employment benefits, liability to participating employers based on the proportionate share of each employer for their financial reporting purpose. The audit was for the year ending June 30th of 2025. These audits were clean audits, meaning there were no issues identified, and schedules were presented fairly in all material respect in accordance with generally accepted accounting principle. And DOA has also completed the annual rural hospital tax credit performance audit. We're currently in a process of responding to their audit findings, and since the audit report has not been published yet, we'll wait and present the result of the audit in our September audit committee meeting.
Before we move on there, I just want to clarify, the committee members may be very well aware, but just for the minutes, the 2 items that David is referencing here on OPEB, those are state health benefit plan OPEBs. They relate to the SHBP OPEBs, and they do not have a corresponding inference on Medicaid. While most of the things that we're referencing either are department-wide or Medicaid-specific, those 2 particular items are particular to the fund that is there for the school fund for post-employment benefits for retirees in the school system, and state employees who retired for the state fund. I just want to point out, make sure that you're aware that that's a very good statement. Those are that we have a clean audit there, and very happy that that has progressed in that manner. Thanks.
Yep. Thank you, Joe. Okay. For the fiscal year 2023, GAO conducted an audit, audit identifying potential overpayment or fraud for duplicate health healthcare coverage or benefits for the federal government and selected 6 states, including state of Georgia. The audit found that many members were simultaneously enrolled across multiple states in Medicaid or Children's Health Insurance Program, which is CHIP, or receiving an advanced premium tax credit across multiple states. Currently, we are working with a vendor to disenroll those members who may be concurrently enrolled across other states in Medicaid and CHIP programs.
Okay, David, just before we leave that, just so that they have a good perspective, I know that this says the GAO found there to be 1.6 billion in potential overpayments. That is not what we found in Georgia as one of the 6 states. And, we have initial recoupment activities that are ongoing in the magnitude of 45 million across various CMO and non-emergency medical transport vendors. So I just want to give you all a perspective and understanding that that is not indicative of the amounts that we are seeing. And those Paris amounts that are reflected for that 45 million are over multiple fiscal years. In fact, I believe it's over 3 state fiscal years that they touch upon that we're initially looking at. However, we, of course, will continue to look at that and we'll continue that process into the future. But most of this magnitude, in my opinion, is not with the state of Georgia. So I just want to make sure y'all are clear that we're a subset of that 1.6 billion that's referenced here. Thank you, David.
Here next is the state purchasing performance audit that was recently conducted. DOA conducted a follow-up review to determine the extent to which state entities address recommendation from their 2024 special examination. The special examination evaluated state purchasing and competitive bidding, including review of purchases to determine compliance with the state competitive bidding requirements. There were a total of 6 findings in their 2024 review, and 2 of those findings, number 3 and 4, were related to DCH along with some other state agencies. In their follow-up review, DOAA has concluded that DCH has implemented all recommendations from the prior special examination, and DCH is in full compliance with the state's procurement policies.
And here, David, I just want to give kudos to the Inspector General's office who oversees our purchasing internal audits and is the primary reason that we have a clean audit here, in my opinion. So just very good job, and I'm very happy that we have a clean audit in this respect.
Oh, thank you, Joe. Okay, next, we'll go over the FY25 fiscal year 2025 ACFR and single audit. For the fiscal year 2025, there were 2 main audits conducted by DOA, single audit report and annual comprehensive financial report, which stands for ACFR. The single audit report is the annual audit report of the federal program compliance, and annual comprehensive financial report is the annual report of the financial statement of the state of Georgia. For the fiscal year 2025 audit, which was from July 2024 through June 2025, it was completed in May of 2026. Opinions are now rendered at the state level. Opinions are rendered at the state level for both ACFR and single audit reports, and they are not given at the entity level. A modified opinion, which is a clean opinion, was issued for the General Fund, Medicaid program, and SHBP at the state level. Qualified opinion was issued for the Children's Health Insurance Program. Qualified opinion on a federal compliance audit indicates the auditor found material noncompliance that is not pervasive across the entire audit, meaning the audit is largely reliable but contains specific issues. The finding which caused the qualified opinion will be discussed later. In fiscal year 2024, there were a total of 8 findings, which 4 were federal award findings and other 4 were financial statement findings, and these are prior year findings, not the current year findings. First, the federal award finding is on the application document management program. This finding is also issued as a financial statement finding per auditing standards. We're still working to document the risk analysis for a few more applications, as well as the work we do around service organization control reports. The expected completion date for this finding is December of 2026. We have resolved the next two findings related to the Medicaid capitation payment rates and CHIP program eligibility determination. We're still working on implementing corrective action plans to resolve issues around the Medicaid eligibility determination for ex parte members. The expected completion date for this finding is December of 2026. The first prior year financial finding is the same finding as the federal award finding we just went over. The second finding is over the cash accounts. We are still working on completing bank reconciliations in timely manner, as well as cleaning up old items from the prior years. The expected completion date is July of 2026. Next two findings are related to the accounting controls and accounts receivable, which are financial reporting errors and deficiencies for the purpose of annual comprehensive financial report. These are financial reporting deficiencies related to excessive and unsupported post-closing adjustments, transactions recorded in the incorrect fiscal year, invalid, incorrect accounts payable and receivables on the general ledger, and some of the misstatements on the financial statements. The expected completion date for these two findings is July of 2026. Next couple of slides, we'll go over the findings issued in the fiscal year 2025 audit, which was recently concluded in May of 2026. There were 4 federal award findings and 5 financial statement findings issued in the fiscal year 2025. Among total of 9 findings issued, there were a total of 5 material weakness findings issued in the fiscal year 2025, which 4 were financial statement findings and 1 was a federal award finding. A material weakness is a deficiency in internal controls that there is a reasonable possibility that a material misstatement of the financial statement will not be prevented or detected and corrected on a timely basis. Material weakness in internal controls over compliance is a deficiency that internal controls over compliance that there is a reasonable possibility that material non-compliance will not be prevented, detected, or corrected on a timely basis. A significant deficiency is less severe than a material weakness, but important enough to merit attention of those charged with governance. First 2 findings are repeat from last year, as we discussed earlier, and we are currently expecting to resolve these findings by December of 2026. Next two findings are related to the eligibility determination for CHIP and Medicaid programs. The underlying issues of these findings were result of incorrect eligibility determination at the defects level. Corrective action plans were asked and submitted by DHS or defects to DOAA for these findings. 2025 020 finding is related to 2 CHIP members who were covered by TPL insurance and should have been deemed ineligible. 2025 021 finding is related to 3 non-SSI members who should have been deemed ineligible. First 4 findings, the financial findings are repeat from last year, as we discussed earlier, and we're currently working to resolve these issues in 2026. Last finding is related to the letter DOAA issued back in March, which we went over in the last audit committee meeting. Due to the multi-year general ledger cleanup effort that DCH Finance is currently doing to correct various unsupported balance sheet accounts, DCH recorded 57 correcting journal entries, which DOA auditors deemed as insufficient document to determine if the appropriate program and funding source allocation required for budgetary compliance reporting. We're currently working to resolve these issues for the fiscal year 2026 audit. Last item for today's meeting is on the audit, enforcement, and risk oversight initiative by HHS. Recently, HHS Office of Assistant Secretary for Financial Resources announced a new initiative designed to hold states accountable for persistent audit noncompliance, including chronic audit noncompliance, unresolved findings, and delinquent audit submission, which will no longer be tolerated. HHS will work with the states, including state of Georgia, to resolve audit findings and implement proper internal controls to safeguard Medicaid from fraud, waste, and abuse. The initiative is to ensure that issues affecting HHS-funded programs such as Medicaid and CHIP are identified, addressed, and resolved in a timely manner. We're currently working with our CMS partner to provide updates and resolve findings and implement proper internal controls as needed. And lastly, I'd like to mention that the leadership of DCH takes every audit as an opportunity to improve and is committed to making the changes necessary to come into compliance. The tone at the top is very strong. And as always, we thank you for the opportunity to share this update with you. Chairman Cruz, I'll hand it back to you for any questions or comments.
Thank you, David. Let me just see if there are any questions or comments from our DCH board members. Hearing none, David, I just want to thank you on behalf of our board for the good work that you and your team do. There's a lot of audits going on, a lot of work here. Follow up. We appreciate your work and appreciate the good communication. Joe, we appreciate your participation and your clarification of some very important issues today. If there's no other business to come before the committee today, we'll stand adjourned. Thank you very much.